I've had many patients ask me, how did I get into treating lipedema and why do I do it? To be honest with you, the first 8 years of my practice, I was treating lipedema patients. I didn't even know it until a patient pointed it out to me and I learned more about it. My background was in dealing with patients who've lost a lot of weight, but we noticed that their legs oftentimes wouldn't improve. And we were doing liposuction and skin excision, and over time, I learned about lipedema. My patients have taught me a lot, and I still learn from them. I see how much better their life gets after we do surgery. I hear stories how they can go hiking in the mountains, how they're winning races on mountain bikes, how they can do things with their kids, how they can go skiing again. It is one of the most rewarding procedures that I do because not only does their appearance improve, but their function improves, their outlook on life improves. They can go back to work, they can interact with their family again, and the pain is gone. So it's an aesthetic procedure, it's a reconstructive procedure, it's a procedure that treats pain all in one. I have a great passion for it, I love the patients, and I hope to keep doing it for a long time.
What I really like about treating lipedema patients, so not all plastic surgeries are like lipedema surgery. Lipedema surgery is highly effective at helping people feel better about themselves. And that means, for me, happy patients walking through my doors after surgery. I get to watch the change it makes in them. I get to hear them talk about how they can keep up with their kids finally at a theme park, which I don't know, is surprisingly common after this. But the very high satisfaction with the surgeries almost always makes a really big difference in the lives of lipedema patients. And I really like that. I like knowing when I see follow-ups that I'm not going to have really unhappy people or people very dissatisfied with stuff. And I'm almost certain to have happy people with lipedema, which is great. That's kind of what I like most about it. Just seeing the change in them and how the disease is no longer gripping their whole life.
What do I love about treating lipedema patients? Being part of their journey. They've lived majority of their life thinking something was wrong, but never had a name to their disease. They now have a name. It's called lipedema. And I'm fortunate enough for them to choose me as their physician to take care of them. And being part of that journey where they come into my office with very little hope, leave hopeful that there is something that can be done, and then seeing them at the end of their journey where they have huge improvement has been just an absolute joy.
But what I'll tell you is the patients are universally very grateful. The average patient takes about 15 years to be diagnosed with lipedema and actually start getting the treatment. So once they found us and they talk to somebody who actually understands them, who understands the disease, they feel that finally they have the connection with the person who can help them. And the degree of appreciation for what we do is absolutely tremendous. Knowing that on some of the patients I remove over 100 pounds of fat when 5 other doctors told them it was impossible, they just need to lose weight, go and diet and exercise. So finally they see the improvement. After every single individual surgery, they see the improvement. And they come in, it's usually huggy time and it's usually a lot of smiles, and they usually become one of the best advocates for their family members. I usually talk to 2 or 3 or 4 people in the room because one person has lipedema and 2 other relatives are very skeptical about the condition. And our consultations take easily over an hour. But after that, the whole family is on board. They're all united, they're ready to go, and they're ready to support that family member. So I think it's a lot of kind of personal gratitude that keeps us going, and it's a lot of kind of positive energy that we get from it. So that's why we do lipedema.
The thing I love the most about treating lipedema patients is it's one of those operations that has probably the highest patient satisfaction out of any operation in plastic surgery. It's very similar to breast reduction, actually. If you do a breast reduction on a patient, they love you for the rest of their life. And in the same way, these lipedema patients are just being able to, help them with their symptoms, the pain in their legs and the chronic tenderness, and being able to exercise and being able to get out and live their lives is so it's just so great to see after the operation, and they're patients that they're with you for the rest of your lives, and so it's a great patient population to work with. They're extremely educated, they're extremely motivated, and they're just, they love you. So it's fun to treat in that sense.
The reason I like treating lipedema patients is twofold. The first is it ties in with my body contouring practice pretty easily. It meshes very well in terms of doing body contouring, so liposuction and the skin excisions. So my experience there gives me a lot of experience with lipedema. And then the second reason is really just seeing the joy in patients' faces and their lives when they come back after 1 or 2 surgeries and say, I'm able to walk, or I'm able to run or bike, or whatever it is that they did, 10, 15, 20 years ago that they weren't able to do for the past decade or so. And that's, for me, the most fulfilling thing.